So the learning objectives for the presentation that I will be giving is really about the concept of healthy aging. What is it? Why do we believe that it's so important for pharmacists to know this? And what's your job? And also the global perspectives on the importance of vaccination in older adults. I think we have to step back a little bit because way before COVID-19 was in the midst, we knew that the 10 global threats that were identified by WHO to our global health really had a lot of relationship with infectious diseases. And being a pharmacist, you're at the front line of consumers and systems around infectious diseases and treatments. So it's important to recognise that well before COVID, we were acknowledging that pandemic, but also vaccine hesitancy, the importance of primary healthcare, etc., were really part of those global threats that we needed to address. And many of them, we were really exposed. In the midst of the pandemic, we really understood that our healthcare systems weren't working in a streamlined fashion, and also there was disconnects between primary, tertiary, and post-healthcare. Look, there are a number of demographic upheavals. These are external drivers that really not only shape our health systems, but the responses that we need to create. So population aging is only one of them. But alongside that, urbanisation, the proportion of people that are moving from rural to urban settings really impacts our ability to respond to their needs. Globalisation and, of course, migration. With natural and man-made disasters, we see many millions of people, moving across the globe. The decade of healthy aging, has some certain and uncertain health challenges. Decade of healthy aging is 2021 to 2030. And the uncertain health challenges, climate change, infectious and non-infectious diseases, drug-resistant microbes. But the certain challenges that we know are population aging and an increased prevalence of chronic comorbid conditions. Just to take us back to what in 1948, WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. That really has changed over time as we really understood, the impact of not only health and well-being, but mortality and morbidity. So healthy aging, according to WHO, 2015, the Aging and Health Report, the first evidence-based report on aging and health, said it is a process of developing and maintaining functional ability that enables well-being into older age. So I want to highlight that it is a process and it's about developing and maintaining function. And so when we talk about vaccination and vaccines, it's really to maintain and improve our functional ability and our productivity. So this slide really depicts the interrelationship between a number of intergovernmental agendas. And as an advocate for older people, I can say that ageism is one of the barriers through which we must look at the uptake rate of vaccination. We look at immunisation across the life course, so we must take into consideration from birth all the way through to death. The rights of older people in long-term care facilities are exactly the same as the rights of a child. And so we need to make sure that our policies and practices and your practices at the front line really respond to the unique needs of every population group, including older people. This framework really talks about the relationship between the UN decade, the WHO Immunisation Agenda 2030, the UN Sustainable Development Goals, and also a document that's come out from WHO, Integrated Care of Older People. The guidelines within that, are being reviewed now, and I'm very pleased to let you know that vaccination will be in those guidelines alongside mobility and vision and hearing care. So vaccination is talked much more about in the context of older populations. When we talk about a life course approach to health, as I've mentioned, we talk about functional ability and intrinsic capacity. Intrinsic capacity is all of the physical, social, psychological, and emotional aspects of our life. But we can see that the trajectories change over time from birth through to early and later childhood and adolescent, youth and adult, and then in older adulthood. When we talk about functional ability, it's the person within the environment. So it's the interrelationship between functional ability of a person and the environment that gives rise to healthy aging. And so for an older person living in a rural and remote area, their environment impacts their ability to access health services. And that's why community pharmacies are so vitally important for people of all ages, but the environment gives rise to their ability to be able to converse, to discuss their health needs. This is a very important slide because, in the latter half of life, there are usually a number of different trajectories that older people could go through. One is a high stable capacity, and you can see that over time, that capacity gradually diminishes. But then you've got those people that have a declining capacity, and that could be because they have several chronic comorbid conditions, and over time there'll be complications such as diabetes, peripheral neuropathy, diabetic retinopathy. So you can see that they have a declining capacity. And then in the latter, the third box is significant loss of capacity, and that could be somebody that has been independent for quite some time, but the diagnosis of a brain tumor would mean that they have a significant loss of capacity, rapidly. What we're trying to depict here is in every part of these trajectories, there's an opportunity to improve functional ability and improve intrinsic capacity. And one of the aspects is one of the most effective public health interventions, and that's vaccination. Older people and those with chronic comorbid conditions, diabetes, lung conditions, etc. These two slides, talk about the different trajectories, but I'd like you to focus on the trajectories of physical activities. What we know is that, a person that has influenza in their older age with chronic comorbidities that is hospitalized, their return home, they will have moved from independent and high capacity all the way through to a significant loss of capacity. So, an older person with an infectious disease never returns to the original functional ability. And so we talk about the number of people that are dying from infectious diseases. We should also be talking about the number of people that have a significant functional decline and the impact and burden on the healthcare system. This is just to remind us all that we need to create knowledge, to have the evidence, to then advocate. And in our job, it's to influence policy. And in doing that, who do we communicate and how do we communicate? I'm going to give you two examples of our work. And I want to acknowledge Gonzalo Souza Pinto, who I know was one of the leading lights in your organisation in the development of, the FIT toolkit. Well, the IFA has a toolkit that focuses on policies. So expanding those who can vaccinate, such as pharmacists, seamlessly improving the pathways, prevention, the education and the information that you disseminate. How do you disseminate it? Do you take into consideration different levels of health literacy and, of course, equity? And finally, the IFA, oddly enough, being an organisation of those who advocate for older people, have now created, a World Coalition on Adult Vaccination, which brings together experts across sectors and across disciplines. And that's one of our vehicles to actually disseminate information, but bring into, a point of contact.